got it open. So I have my other alcohol, right? So here's the during. Hear it?
Yeah.
Squeaky clean. Okay, so now I've got it open.
Part of my job is I have just a saline, just to keep an eye on that hub, make sure air isn't going down there. So just to drip drip.
So she's gonna drop
Yep.
that so there's no air. And then she's got this one that has the cap on it, okay? And now she's gonna do this. Okay, and then I take my other alcohol and after. Okay?
There you go.
I try to be funny about it, but it's really serious. And I will tell you, one of the things in our practice, our quality director came around a few years ago, and you know how we would use these on just kind of a microbore if they're getting antibiotics or something like that, right? And so we don't want to leave syringes on that. And so we take it off the pump and we kind of coil it up till it's the next time that they need an antibiotic. Well, if you notice in here, when you clean with that alcohol, you want to do this. Well, they make, what is it called, Linda? This, I call it spray
the
bugs.
Curos, the caps?
No,
Or no?
it's anyway, our director came around and it was, I call it bugs. So she sprayed this little solution on there and she said, scrub the hub. And I said, okay. So I did it. And then she took like the blue light and it showed how much stuff was still in there. So my practice changed after that day, because normally you would go to the pump, right? You would clean before you put that syringe on, and I thought I did a good job, but I could clearly see that I could do better. So I did that, and so now in my practice, I will use 2 alcohols to scrub that hub, because you can clearly see that there is stuff that would be left in those little crevices, even though it's a closed system. So.
Do you guys use alcohol caps?
We do. Curos caps. They've been
We
green.
did, but then the hospital stopped
Okay.
purchasing, so we don't have any.
They've been green. They've been orange.
They stopped. Now we're not using them. So it feels weird. It's odd.
Yes,
Yeah.
when you're used to using them.
When you're used to using them. So.
Where all those doctors have alcohol?
No, we use Preventix. And they said the alcohol would get into the actual line, so they took them away from the babies.
And that's a hospital, you know, you've got a quality department, infection control that helps guide you guys, and so that's your governing body to follow. So as long as you know, that's why I think it's important to know your policy and procedure, so that if you're following it, that's your backbone, okay?
I had a question, so when you prepare the lines, you lay it on a sterile surface?
So usually I will get in my personal practice, I would go get a bedside table, clean it with the purple tap wipes, right? And then I would go open all my packages and put it all together and prime my line, clean. Anytime I'm touching tubing, I have clean gloves on. Anytime I'm touching the baby.
So not sterile, no, they like
No.
sterile towels.
No. Yeah, I have a nice top, clean, put it all together, and then when I'm ready to start to open the line, that's when I grab my partner and we do a sterile change.
We use like the package from the sterile gloves and leave that on the bed next to it, so that can be your sterile field for the right of infection. So
Yeah, yeah,
usually
because
some
actually
people do
tubing's
that.
not sterile.
Yep.
Right.
That's our big, like,
Yeah, and that's why your partner, they'll hold it for us. So that way, I'm sterile and I have it open, and all she has to do is put a little saline in there and then connect it for me.
I think that's very ideal because your statistics is like where the eclampsia is.
Yeah. The other thing we do, we do a daily central line audit. So at our bedside for each patient that has a central line, it has a series of questions. Yeah, so I think that's a good practice as well. So it asks, if we come around and you can say, do we really need this? Should we be leaning this? That kind of thing. All those types of
do you have to scan your pump at the same time when you're changing the lines?
We do a barcode scanning system, and I will tell you, I want to answer that, but we just went to Epic last week. So great question. No, we do have a scanning system to make sure that we would make sure our TPN is scanned.
So do you bring a third nurse in to scan for you?
Usually would check it first, and we would check it. She would come over because we double check TPN anyway.
Prior to.
Yeah, and so then we would scan it. I would probably scan it right before I'm hanging it. So, the last thing that I was gonna kind of just have discussion about is complications. So we talked about maybe a catheter breaking in an emergency situation. Talk to me about what would you think? So we know that this is centrally located and it's not gonna be like a normal IV infiltrate, right? So a normal IV infiltrate, we're looking at the site, gets puffy and red, and you gotta do something about it. How would you know if the central line began to not function properly or cause issues
You
for the
could check
baby?
like swelling around maybe the shoulder, the back of in the back.
Uh-huh.
Here, or the-
Yes.
Measure the girth of the arm.
I pulled a really good article, it was done in 2020, so not terribly long ago, and I'll leave this for you guys. But there's, a picture of maybe some neck swelling, but I'll tell you, that's probably not, it's gonna be probably going on for quite some time to when you see that. So what are some other like signs and symptoms that you could think of, that this catheter is infiltrated?
Arrhythmias?
Could?
It goes.
So, tachycardia, right? So you have to think about the baby's heart, and now fluid is filling up around the baby's heart. So the baby's heart's not able to squeeze effectively. So what can you think of your vital signs? What would you see?
Hypertension.
Hypotension, so blood pressure changes, trending on the low side. So kind of the things of cardiac tamponade. So I think of it this way: if my heart's not squeezing right, my heart rate goes up because I've got to get those trucks moving around, and I increase my speed. So you would have tachycardia. Linda has, this is a true example of a baby that we had in December. You want to point out the...
So this is the original X-ray on the baby. I don't know if you guys can see it. See how the PICC line's kind of in the shoulder? It's not ideal placement. Our babies. A little screen. I was trying to get
We were trying to get an
experienced
old,
nurses.
we were trying to get an old school like film.
Apparently you can't print an X-ray.
You can't print them anymore.
I dated myself by asking.
We're too advanced.
Yeah. Oh, I didn't know that. Let's see where that one is. So the next day. Next day he looked like this. See how big his shoulder, how unequal his shoulders are. Yep.
And you can see, and that's what I like to go back when you count top to bottom, right? Because you're counting ribs, and not maybe babies don't have all their ribs, right? But you can also see when you look from outside in, not only can you see like fractures, but you can see the edema. You can see like ascites and that kind of so forth. So it's always important to kind of look at their, you see their arms, but you can tell if a baby has edema going on.
Wow.
He probably was uncomfortable.
My one experience with a baby that did have a PICC line infiltrate, but it happened very quickly. Vital signs were trending, just like you said. Blood pressure was tanking, heart rate was up, respiratory rate was up, and everything. And we got the X-ray, and it looked similar, to very hazy and white. And what can you think of? What would be the emergency? Like, how can we help this baby? Fluid is all around the heart.
A tap to get the fluid out
Yes. So how would you go about doing that?
to the site.
Okay, so your nurse practitioner, your doc will come, and what kind of supplies would you think you might need for a chest, to tap the chest?
Syringe,
And then your catheter, so whether it's like the butterfly or a regular like angio cath. So you're exactly right. So that's what they did. and they inserted, we betadined and inserted, and we pulled lipids off the baby's chest. This was like 20 years ago, but, and thank God it's never happened again for me. But yes, you can, they tapped the chest, and they got liquid, milky liquid substance out of the baby's chest. So
Can we get chylothorax?
they could develop a chylothorax, but in this case, it looked like just like the lipids we were giving the baby. So, yeah. So, what other complications can y'all think of? I have my little notes to make sure
When it's stuck, when you're trying to take it out,
okay, how do you DC it?
you just take it out.
Hairdressing.
So you got an order, it's not sutured, right? So you got an order to remove it. What's the process of removing it? How fast? You just,
It's very slow.
yeah, it's like 1 cm
One cm
per
at a
minute.
time.
Yeah, yeah. So, a narrow pulse pressure, so that low blood sugar, not blood sugar, blood pressure, you can see that maybe the difference between the systolic and diastolic, you can start to see those numbers narrowing, and it could be a narrow pulse pressure. So, those are the big things I had on my list. Do you think of any complications that you've encountered in your?
Those are the big ones. I did want to point out though that I have seen, where, the catheter looks like it's central on x-ray, but it's still leaking. And so it takes a little bit longer for that edema to develop on the outside, but you can't just go based on a non-central looking PICC on an x-ray, because it could look central and still be infiltrating.
Good points. What are the things that would y'all like to talk about, or we will stick around for a few minutes if you want to, work with some of the supplies, practice, changing something, we're happy to do that so you guys can have some hands-on. We kind of worked our way through insertion to dressing changes to the daily care, to just DCing it, and complications.
You guys have any questions about anything else?
How would you do a blood culture?
Well, that's a good question.
2-person thing,
Huh?
the 2-nurse thing.
So again,
I haven't done it.
anytime that you're gonna access that line, you wanna have 2 people to help you, or a 2-person gig. And we don't necessarily, it's not a common practice to pull blood cultures from the PICC line, because a lot of times it won't draw back. But in my career, I have been asked to do that. So again, our process, and this would be, what your policy would be, is that I would change this out, right? Because it's been there, things could be there, and so we wanna make sure that we get a very true sample. So again, hat, mask, gloves that are sterile, removing that piece off, clean, and then hopefully we would be able to draw back that 1 ml in our lab tube that we use. You want like 1 ml of blood, so we would just draw that first ml of blood off, and then hopefully put it in the lab tube. And then your partner again,
We would take out
Some of that
fluid
stuff
first and then blood, or?
the first ml.
We usually just do venipuncture for blood cultures to avoid,
Yeah.
messing with the line.
Yeah.
If they want you to do that, you can. My take home is anytime you're doing a central line, you do want to take it from the hub. So if you're doing it from your UAC, you would make sure that you disconnect to the hub and clean that real good. Make sure that you're not pulling through anything that's just been there.
Yeah.
Okay? Stop cock or anything like that.
What size syringe are you using?
We usually use a 3. But I'll tell you, the flushes, these are old. I get all the expired stuff. But the 10 ml syringe is technically the best one because of the force and the friction, so that you're not going to fray that catheter. So.
I guess we don't mess with it because we don't have the double lumen one. Like we need the double lumen.
And we used to do more blood cultures from the PICC lines a long time ago, like before, but we really don't see that anymore. We don't usually do that. Yeah, yeah. But again, but if you're gonna do a peripheral blood culture, right, your betadine, right, is circular, and y'all don't use the CHG? No. If you use CHG in any part of your world, just remember CHG is friction, back and forth friction, where betadine is circular and you allow it to dry. Okay. And we always like to use you guys have the betadine swab sticks, right? So a take home is to when you find, if you're doing an arterial stick, how do you do this is going off, I'm going off on a tangent, but I realized this with some of our newer team members. How do you, if you're gonna do a blood culture, what should you do first?
A blood culture is from an arch stick?
Uh-huh.
Oh.
You should clean the arm first with just a regular saline wipe.
Okay, but if I'm gonna stick, if I'm gonna, you don't do it?
Well,
Okay, wait,
the
wait.
nurse practitioner.
Okay,
Oh.
okay.
Okay.
Well, do you remember the Allen test? How do you correctly do it? So if Jose comes over and he's gonna do that, how do you know he's doing it correctly? So if you occlude both arteries, the radial and the ulnar, right? Most of the practitioners are gonna stick the radial, and because there's more nerves along the ulnar, so you're gonna occlude and then you're gonna lift up. Yeah. It hurts. She's gonna make sure that I have collateral circulation. So that is super important to make sure that you have perfusion below the site that you're gonna stick that vessel if you're doing an arterial stick. We found different variations of how people were doing the
Yeah.
Allen test.
Is it a positive or negative?
So,
That's usually the other question.
I think it has to do with the charting, because some charting systems will
Okay.
say one's negative, one's positive. So it depends on what charting system that you're using. So anyway, side
That's
note.
when you chart good collateral
Good collateral
circulation.
circulation.
Pulse is noted distal to the site. So
Neither positive nor negative.
Yeah. Yeah.
Or adequate.
Yeah.
Collateral
There
circulation.
you go.
Yes. So, but just something to be on the lookout for, because if they have done blood work and they've done an art stick or even a venous stick, you want to make sure that you are assessing below the level, distal to the site of where the stick was for